Recent high-profile knee injuries like the one involving Olympic skier Lindsey Vonn are putting a spotlight on just how complex knee surgeries and recoveries can be. Today we're joined by Dr. Jeannie Buckner with Roper St. Francis Physician Partners Orthopedics to break down what these procedures really mean for athletes and everyday patients. Thank you so much for joining us today. How are you?
Thank you for having me. I'm doing great. I'm glad to be here.
Awesome. Well, we've seen athletes, like we discussed Lindsey Vonn, undergo knee procedures. What kind of injuries typically lead to surgery?
Yeah, that's a great question. Lindsey Vonn is such a huge competitor and everyone's watching the Olympics. I think that was a pretty heartbreaking injury for all of us to see, and she kind of did a number on it. That was a pretty severe injury. So knee injuries come in a full spectrum. Any type of fracture, especially a displaced fracture, any fracture involving the joint, any multiligamentous knee injury, you hear the high profile ACL, MCL, all of those are going to lead to surgery. I primarily do knee replacement surgery, so what leads to that can be injuries with trauma or just arthritis, wear and tear over time.
Gotcha. Could you tell me the difference between the two? Because you said knee replacements. Could you kind of differentiate the two when it comes to like knee surgery, knee replacements?
Yeah. So knee surgery comes in pretty much every flavor of the rainbow. So you have small procedures like knee scopes. So you have a meniscal tear. Meniscus is a little fiber cartilage disc that sits in between the two bones. Go in, clean that up, kind of a clean up, 2 little poke holes on the knee. You have something like what Lindsey Vonn had, where she broke the top part of her tibia. So the knee joint's made up of the tibia, shin bone, femur, thigh bone. They come together and make your knee joint. So she broke the top part of it, involving the articular surface, so the joint. So she actually had an open reduction internal fixation. So a big plate, lots of screws, lots of rods. The other spectrum is multiligamentous sports injury. So you tear your ACL, tear your PCL. That is also a semi-arthroscopic, so with the scope, and semi-open procedure to repair those. What I do is kind of taking everything out. So once the whole joint's gone, I give you a full knee replacement, replace it with metal and plastic, and give you a new joint that's straight and works well.
Now, would you say that these knee surgeries have become less invasive? I know with all the technology that we have these days, what would you say maybe you've seen in the past 5 years when it comes to the technology aspect of it?
Yeah, I think we see that in every department of orthopedics, sports, arthroplasty, everywhere. We've made huge advancements. Used to be if you had an ACL tear, you have a big open incision in the front. Now it's little poke holes and smaller incisions. Same thing with joint replacement. The robot has helped us be more precise and more accurate, trying to do minimally invasive, muscle-sparing type techniques. So I think it's an exciting time for orthopedics, and there's been a lot of growth over the next 10, and projected growth for the next 10 years as well.
And correct me if I'm wrong, but I'm sure that these less invasive procedures that are happening now, the recovery process is probably so much easier for these patients.
Absolutely. The goal is getting people up and moving. We used to, for example, for knee replacement, you used to be in the hospital for 4 to 5 days, short-term rehab for 2 to 3 weeks. Now most patients go home the same day or the next morning.
It's amazing.
They're in the house, they're doing therapy. Same thing with sports. We're just trying to accelerate the recovery for people.
Amazing. Does having one knee surgery increase the risk of needing more down the line?
Unfortunately, yes. There's kind of a spectrum of post-traumatic arthritis. And if you have an injury, even if it's fixed perfectly, perfect patient, perfect surgery, it's never exactly the same. And that can predispose you to further injuries, muscle weakness and damage to the joint.
Gotcha. What can people do now to protect their knees and just avoid surgery altogether?
You want to avoid all of us, which I get. I think just staying active, being physically active, and keeping the muscles around the knee strong. The knee is so dependent on the quad, so the big thigh muscle. So if you work on quadriceps strengthening, plyometrics, landing mechanics, all of those things are huge.
So for our viewers, where can they go to find out more?
Yeah. Local orthopedist, we're always happy to see anyone and everyone. Speak to your physical therapist. If you're younger, your athletic trainers and your coaches or your advocates. I think just anyone in the community. Obviously, Roper St. Francis is always happy to see anyone. But orthopedic docs, physical therapists, family med docs, everyone's here to help.
Thank you so much for being here today with us and sharing all of this amazing information.
Well, thank you. Thank you for having me.
Thank you. We'll be back right after this.